guys, it's your girl Teresa. Welcome to the Dental Assistants Corner. And if you are a subscriber, welcome back to the Dental Assistants Corner. And in this video, I want to answer another question that I've been getting a lot lately, mainly from patients. And it's, well, what is your next step? Like, is this the last stop for you so far as dental assisting? And it's not something that I really thought about much until I was, I'd say, about halfway through dental assisting school, because I always said my original goal was to be an assistant, be a hygienist, and then be a dentist. But it wasn't until I actually went to dental assisting school and started working and interning, and then when I started temping, it was a question that a lot of people asked me, knowing that, when I first started temping, I had just graduated. Like, have you considered a specialist? Because I know most some of you know, but for those of you who don't know, there's the orthodontist, the oral surgeon, the prosthodontist, the pediatrics, there's all of that. And you can go and be an assistant just specifically in that specialty, or do you want to move on to hygiene? Do you want to move on to be a dentist? And then from there, do you want to be a root canal specialist? Do you want to be a prosthodontist? And so on. So when I first graduated, and if you watch my channel or if you know me personally, you know that when I first graduated, I was just trying to work anywhere that was willing to hire me. I don't know if this sounds bad or not, but the only thing I wasn't really trying to do was pediatrics. And it's not that I have an issue with working with kids, it's that basically a kid that goes to a pediatric dentist is a kid who cannot go to the regular dentist because they're too scared, they're crying, they're screaming, and you just show them a toothbrush and they lose their mind. So I honestly just don't feel like that's something I would be the right person for. So, that was the only one I wasn't really willing to do at first, but then I reached a point to where I was really like, I will work for Dr. Seuss if he is a dentist that will hire me. So once I actually started working, then I did start to kind of think about what my next steps were. I had a working interview that seemed really promising for a prosthodontist assistant, which is basically implants, the oral surgery and the implants. And I was like, that's something more of what I could do. It wasn't so far as general dentistry, and it was actually paying a decent amount, which it wasn't just about that, but not gonna lie, that helps. And I was just kind of like, well, that is something that I was considering. And then I did consider ortho, because I had a lot of assistants tell me that they like ortho because with ortho you work more independent. And I thought I was the only person that had this problem, but you are able to kind of work well when you work independently, because you can kind of learn specifically what works best for you and not necessarily have a bunch of people standing over you telling you you're doing it wrong, even if you're not. I'm not saying you won't deal with that with ortho, but for something where you work more independently, I could see. And then I consider oral surgery, because with oral surgery it's pretty much knowing the instruments and suctioning. It is a lot of blood. It's not something that I have a problem with, but I have heard of other people having that problem as well. So there's that. But I just really looked into it, like, well, what do I want to do next? Because even in general dentistry, there's different levels of it. So, you're certified and registered to do more. So there's that. But to just kind of answer the question, my next step is hygiene. I do want to be a hygienist. And I feel like that is something that I will definitely be able to grow in, and being that I started off as an assistant, once I go to hygiene school, I am going to kind of know some of the stuff that I'll have to know already. Like, you're gonna have to know tooth surfaces, you're gonna have to know how to take x-rays, you're gonna have to know about the different types of gum disease, bone loss, things like that. So I do know about that from being a dental assistant slash being a hygiene assistant. So that's definitely my next step, and that's something else where you do kind of get to work a little bit more independently in. So that is the reason why I consider that, because I don't necessarily want to say I like to work by myself, but I do like to have a career, or even just when I had regular jobs, to where as long as I'm doing what makes sense and what's legal, that's all that matters, versus no, this is the way you have to do it. And it's like there's usually more than one way to do things. I just decided I just didn't want to be a dentist anymore. The first reason for that is because I found out how expensive dental assisting school was. And as I've said in some other videos, I don't want to take out a loan. If you want to take out a loan, that's good for you, but it's just not something that I want to do, because I'm really just not trying to owe that money, because I feel like if you owe money, or if you're in debt, you really don't have money, so I am not trying to be in debt $500,000. Like, that's just not something that I want to do. So hygiene school isn't cheap either, and I've been debating on whether I want to go to a college like Baker, which is one of the more straightforward programs. You do have prereqs to take first, but then they have the classes you have to take. But I've already started on my prereqs at a community college. It's just that I'll probably have to cut down my hours, which is why, I said I will wait. Like, one of the hygienists was like, I think you should go into hygiene, but don't wait too long. But my reason for waiting is just because I know it's possible to work and go to school. I mean, I did it. I worked 2 jobs and went to school. But it's not even about whether or not I can do it. It's going to be about the fact that I have to cut my hours and cut my days, so it's possible for me to go to school, because I was taking online classes, so that way it wouldn't affect my work. But I'm getting down to just my science classes, and even then you have to go up to the school for the labs. And being that I work in a dental office, though I work in an office that's open later, I still have to figure out, well, what days am I going to be able to go up to school for the labs and everything. So that's why I just kind of decided to wait. Like, okay, maybe I'll have some money saved up, so if I have a few extra $100 or extra $1,000 saved up, then it's going to be okay for me to have my hours or my days cut for a few months or whatever. But yep, being a hygienist is definitely my next step. I'm 24 going on 25, so I have time. I'm not in a super rush. Being a dental assistant is still a great and a good career, and even in dental assistant you have room and time to grow, into it, and having a great career and making a decent amount of money and not having to live paycheck to paycheck. So it's not like I'm gonna forever just be stuck at something low. So even if I don't decide to move on, or even if I do decide to move on 10 years from now, who cares, right? Better late than never. So that is that, you guys. I know I said that I was going to start posting every week, but sometimes I'm not sure what or how I want to post it, so I just don't. But I really do want to use this channel to kind of help everybody who's in dental assisting school, or anybody else who just graduated, or anyone else who's only been in the field for a year or so like me, because we can all help each other. Okay, well, thank you so much for watching. Please give this video a big thumbs up and subscribe to my channel, as long as you can handle the tooth. Bye.